All right, good morning. It's Dr. Brian McKay, Core Health Darien. What are we going to talk about today? EPAT, EPAT. You can ask, what is an EPAT treatment? Well, I'm going to go into it, a little wordy. Extracorporeal pulse activation technology. It's a form of extracorporeal shock wave therapy, and it's gaining a lot of attention. I have to admit, I jumped in. I was a little hesitant at first. I jumped in, and let me tell you something. I am thrilled with this particular treatment. And today we're going to have how it deals with plantar fasciitis. All right, plantar fasciitis presents as pain. If you're like most people, you're going to do aspirin. You may do some kind of creams. You may get some kind of a night brace, which is not a good idea. It is so old school. You do more damage than you will good. So please stay away from the night brace. If you do anything, just please trust me on that one. So the next thing you probably do is you're going to make an appointment, probably see a podiatrist. You go in, maybe you get a cortisone shot, maybe you could do some physical therapy, and guess what? You still got the plantar fasciitis. I'm going to tell you why you still have the plantar fasciitis. Plantar fasciitis involves several muscles, and usually the muscles on the inside of your leg, like the lower leg. You run down, and what happens is these muscles become bound up, put pressure on the Achilles tendon. That's where they kind of terminate, and will cause sometimes on X-ray a spur, and it becomes chronic. I mean, if you stand all day, if you're a runner, tennis player, you're real likely to come up with over a period of time. It's an overuse syndrome, but it really comes about when you have issues or imbalances with the leg muscles. That's my idea. I've seen enough. I've treated enough plantar fasciitis over the years. I'm telling you, that's pretty much what the issue is. So the muscles you really got to concentrate on, besides making sure that the 26 bones of the feet are mobile, which as a chiropractor I do all the time, you got to check out the tibialis anterior. It's kind of the muscle that runs like on the outside of your leg, okay? The outside portion of your leg to the tibia, okay? So hence the name tibialis anterior. So it's right there in front, anterior meaning front. And the other muscle is the extensor digitorum longus and the extensor hallucis longus. So those are the three muscles that need to be worked. And when you take EPAT, or if you want to use the fancier term, the extracorporeal shock wave or pulse activation technology, what it does is it breaks up scar tissue. Scar tissue, now, I'm going to go a little bit step further. In the past, I used particular techniques called Groston, which is a way to reduce the adhesions. And adhesion forms is like scar tissue, but it's kind of a cellular level type of a thing. So the scar tissue gets broken up with these pulses, powerful pulses you set for those muscle groups. And let me tell you something. I am seeing much faster results for plantar fasciitis using the EPAT. What happens is a lot of people don't want to invest in the equipment, but the equipment is going to make the job a lot quicker. Like I said, in the past, I used Groston. Groston is painful, effective, but very painful. I use cupping, effective, but again, painful. And so what the EPAT does is I'll program in about 2,000 shocks. There's going to be 2,000. The cylinder is like it's like a gun. It's a pneumatic gun. And if you want to think about it this way, if you ever had laparoscopic procedures to say break up a kidney stone, it's almost the exact same technology. Almost the exact same technology. It's just a smaller unit. So you're not going to go to the hospital to get EPAT. You're going to go to the hospital for your laparoscopic, but it's the same type of idea. So pneumatic gun fires as a bullet in the chamber that strikes the head, and that head creates a shock, which goes in and basically, for starters, breaks up these adhesions. So adhesions occur when there's repetitive stress on a muscle, and the adhesions occur in the fascial plane, hence the name plantar fasciitis. And it's very similar to tennis elbow. Tennis elbow is how I got into treating so many cases of plantar fasciitis. But when it really opened my eyes up to speed up a treatment, it's exciting. I mean, I'm getting better results, faster results. And, when you've got these chronic things and you treat them like you put a brace on, or you go for a run, you ice your foot, you're just scratching the surface. You're not going to do much in the way of changing the overall, structure. That's what I would use Groston for. And I mean, the other thing too is a lot of times, believe it or not, I find the fibula out of place. But that's the fibula would be behind the tibialis anterior and lateral to the extensor hallucis longus and the extensor digitorum longus as well. So by working these muscles, you're taking the tension off the foot. That's the key thing. Tension off the foot. And that tension, when it gets released, allows the arch to restore. Because if you're pulling on the calcaneus, the heel bone, right? You're pulling that up. Okay? What you're doing is you're decreasing the arch. So now another good thing for plantar fasciitis people is to get, I always tell them, there's a brand called Super Feet. You can find them in most running stores online. They run about $40, $50. Really important because you want that curve. You want that arch in your foot. If you look at anything in architecture, you're going to know for sure that basically arch is the strongest thing. You look at a bridge, you see arches. You see a big doorway, arches. The arch is the strongest thing from a mechanical standpoint. So you really need to have that. So that incessant pulling by not just one, but typically three muscles. And and let's face it, I think you're going to see a little bit more of the lateral head of the gastroc involved with a true plantar fasciitis. So our job is to find out what works. And let me tell you something. For plantar fasciitis, it's actually a game changer. So when I get a patient in, I say, I got a heel spur. Well, millions of people are finding, worldwide, are finding, effectiveness using EPAT. 80% report less pain or no pain after a treatment. I was on the phone this morning with a patient who just did some work actually on a knee using the shock wave therapy. But it is so effective. It's so fast, so effective. You might get a little bit of discomfort, but it's really not. It feels like little shocks, little pulses against the skin. But what it does is it breaks up the adhesions that form in the fascial plane that cause you to have the pain, the plantar fasciitis pain. And if you want to get back to running quicker, you need to address the arch of the foot. That's very, very important. You got to address that arch by releasing tension and finding out what muscles are involved. Now, it's not that easy to say. It's not as simple as point and shoot, because part of the work goes into diagnosing. Okay, tibialis anterior is a pretty big muscle. Extensors, the hallucis longus and digitorum muscles, really do a lot of work as well, and those things need to get that tension out. But when I diagnose, I have to take a look at all those. Basically, I'm going to look all the way up to the psoas muscle, because it could be a whole motor unit that begins with the pelvis and goes all the way down the leg. So you have to really evaluate that. But for most of the cases, it's going to be, again, tibialis anterior, extensor hallucis longus, extensor digitorum. So those are the primary muscle groups that I see, say 80% of the time. But when you get these things to release the tension, then you take that tension off the calcaneus, which reduces tension onto that heel spur. So even if you have a heel spur, EPAT shock wave therapy is going to be an effective way to mitigate it. So it's a quick, today's a quick talk, but it's very important. So if you have plantar fasciitis, the EPAT shock wave therapy is non-invasive. The other thing too is I'm actually seeing like about a 20% decrease in the frequency of care. Like say someone comes in for a real tough case of plantar fasciitis. In the past, I would probably say we need 18 visits to get it really under control. Now we're down to like 10 to 12 treatments. So that's really good news, because you can get back to your activities as quick as possible. It's also effective, very effective for tennis elbow. Tennis elbow and plantar fasciitis, if you know how to treat one, you basically know how to treat the other. It may sound very simple, but when you do enough of them, you start to develop a pattern. I'm Dr. Brian McKay in Core Health in Darien. We do things a little bit different here because as a chiropractor, people go, well, I'm going to go to a chiropractor, I'm going to go to a physical therapist for this. We pay a lot of attention to the muscles, the muscles are very important. And what I see happening is the physical therapy world's focusing on the muscles and chiropractors are focusing on the bones. You put the two of them together, it's like putting the peanut butter in the chocolate and you got a Reese's peanut butter cup. And I don't know anybody who doesn't like a Reese's peanut butter cup. But more importantly, if you've got plantar fasciitis, I don't know anybody that doesn't want relief and lasting relief. So you may want to consider shock wave therapy. If you have questions, you can reach out. My office number is 203-656-3636. 203-656-3636. Shockwave therapy, EPAT, it could be the answer to your plantar fasciitis and pretty much your tennis elbow. Got a problem? Get it solved. And also think about those super feet. The super feet's a good way to, again, restore that arch. You need that arch. Otherwise, you're going to have a lot. Actually, the arch starts breaking down in your 40s and 50s on one side. And typically, it's going to be one side. Very rarely, somebody come in with both. So, what it leads to hip issues down the road, and we all know you don't want to have a hip replacement later on. So, a word to the wise is sufficient, as the nun in Catholic school told me. I don't know if I always listened to her, but I didn't forget that line. But you have a great day. If you have plantar fasciitis, think about shockwave. Very, very safe, very, very effective, and a lot faster and a lot less pain. I can't think of there's no downside to it. All right, thanks a lot. Have a great day.